We want to welcome you all in to Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers here in Arizona to help you make the best decisions for your life. It is November 24th, 2020. It is a Tuesday, but a lot to get to today. Garrett, a lot of numbers coming in. The second highest date for cases and a record high for death here in Arizona, sadly. And so as we begin, I want to say that we think of every single Arizona family who has lost someone or who is in the fight of their life right now. We've already lost 6,515 Arizonans to this. So let's start where we always do on the state's page, giving us the very latest numbers as they come in.
So we have today 306,868 cases throughout the entire pandemic, 6,515 deaths. And that is, as you said, Katie, 4,544 new cases reported today. That is the second highest report on any given day since the pandemic began. The first being, I believe, July 2nd, and that report was about 4,800. And so we're just under what that reported number was. The death number 51 is quite high. It's not a record, but it is quite high. It's probably the 7th or 8th highest we've had. We did have some reports in middle of July that were triple-digit death numbers, very sadly. But it is the highest death number we've had since August.
So one of the things I hear you stressing there is reported date versus the date it gets plugged into the system. So important to differentiate for everybody on that. Obviously, it's reported to us once it's investigated and fully confirmed and sent over as that being the cause, and then we plug it in on the chart so we can see how the dates look. So as we plug that back in, it still has us lower than the peak overall, but our highest reported day.
Correct. So this is the actual dates, not the reported dates. And the reason why we could be in a situation where we're at the second highest reported date, but not anywhere near. We're about 75–80% of the way up the if you will, the ladder from where we were back in June. We're at about 4,200. I'm sorry, 4,200 is our peak day right now. And back in June 29th, it was 5,400. That was because back then, if you recall, there was a massive lag in cases coming in. So positive tests were being reported about 15–20 days afterwards. And so that number just kept growing and growing and growing. And what we have now is we have no lag. So we're seeing bigger numbers coming in, but they're more steady. They don't really impact numbers. After about 5 or 6 days, they no longer impact the number of the actual date of occurrence when they're reported. So today, 4,200, 5,400 was our top. We just looked at it, Katie and I just looked at this, and it looked at from 6/30, from this number right here to 2 months prior to that, which is April 30th, there was Arizona added 96,027 cases from this part of the increase all the way up to here. And if we take the sort of similarity from about 9/23, which is about a low, to 2 months back from there to this number right here, we've added 91,240 cases. So as you can see, we're almost at parity to where we were in the rise up in the first surge. But of course, the problem was we don't know when this one's going to end. It may end early. It may continue until, most of the projections we've seen says it's going to continue for at least 2 more weeks. And so that would put us well above our summer surge. If that happens.
Yeah, and you're talking about those surges. We saw a summer surge here in Arizona, and now this fall surge. And as we've discussed, we sort of missed here in Arizona that spring surge that they saw across the rest of the country, especially in New York. We reported on some of those numbers. And just looking back at this whole thing, I mean, Garrett, the first time here in Phoenix, I said the words of this mysterious virus was January 17th. So it just puts in perspective how long in Arizona, although in Arizona we had an early case, we didn't really see those numbers climb as fast until later.
Spending basically a day in the newsroom chasing down some information on that one case, if you remember. And obviously we're long past that at this point. We can't chase down one case anymore.
Right. Okay. So as we look at these numbers and separate out from Maricopa County, about half of those lives lost reported in today were from Maricopa County. I believe it was 26 just from one particular county.
Yeah, and we do see that. We typically see that if with Arizona especially, because this virus does impact people of a older age demographic more often than not. And we know that Maricopa County is home to a lot of retirement communities. It just sort of goes into reason that Maricopa would be harder hit than some of the other counties simply because there's just more of a retirement presence here than there might be in some other counties.
So moving on from deaths and back to this case count, it's sometimes easier to look at a 7-day rolling average for these numbers because in that summer surge of the pandemic, Saturdays and Sundays and Mondays were lower reporting days. As you mentioned, we're kind of seeing less of that now as the numbers stabilize. Obviously, still Mondays a little bit of a lag in there from that weekend reporting. But my gosh, we really saw that in the summer surge. So if we're comparing these situations, are we in a better situation now than we were then? Looking at that 7-day rolling average really helps to understand what's happening.
Correct. And as we're talking, I'm pushing the button to get it to render, and I'll show you where we are. It's done. So let me pull that up. And this is what it looks like. This is the reported, not date of occurrence, just so everyone knows when we're looking at this. What Katie's talking about here is we are now at the point where the reported 7-day average of these case numbers is now higher than it was at its height in early July. So we are now officially, as far as the reported 7-day average, we are now past our summer peak.
So that can feel discouraging sometimes, and we know this. And Dr. Birx earlier this week or last week, it's all running together at this point, held a news conference where she updated ways that we can work to control the spread, and we can work to make sure that that curve doesn't go out longer or even higher. And that's, of course, washing hands, keeping social distance, wearing masks, all the things that we've heard all throughout this, that we can help to try to pull this curve back down in the choices that we make. The other concerning numbers in all of this are the inpatient category, and inpatient numbers here in Arizona, as we always concentrate on Arizona related numbers, are over the peak for inpatient, Garrett.
Correct. So, and I'll bring you, we're just going to use the azdhs data for this because it shows the entirety of the pandemic. And this is ICU. So let me go to inpatient here. Here we are, what we're looking at right here is our inpatient bed right now, as it is actually about 87% right now. We have about 87% headroom in inpatient. We're at about 50% of where we were with inpatient beds in COVID-19. So we're getting very close to having some headroom issues. But right now, it seems that this is actually, we've been talking about this a lot on what is sort of the breaking point of these inpatient numbers and these hospitalization numbers, because while we might have bed capacity, we're starting to see some indications that there are hospitals that just simply have no more beds left.
So beds are a concern, and also the personnel to be staffing those beds. And so, Garrett, so everybody understands this chart. This chart is coming from the state. This is a look at how things are overall. So that's why we can see different situation in different areas of the state. Sometimes when we were seeing hospitals with room here than in rural areas, and here, I mean, in Phoenix, we had hospitals in rural areas that were still slammed through all this. So we can see a different situation based on rural or urban areas. This is just looking at the total, the sum number for the state.
So we have, for example, if you go to Yavapai County's health department website today, you'll see that they put out a number. Let me see if I can get that number really quick. Yavapai County does report hospitalizations on a daily basis, and their hospitalizations today are at the highest they've ever been. And this is, let's see, where are they? Right there. They're reporting, where is it? It is right there. They're reporting 59 hospitalizations. While that may not sound like a lot, this is basically, they only have 4 hospitals in Yavapai County, and that is the highest number they've ever reported. And then we also have, like, for example, Yuma Regional Medical Center, which is a larger hospital, but it's the only one that services Yuma County and Imperial County, California down there. And they're back in the triple digits for the number of hospital beds that are being occupied. They haven't been in the triple digits for several months now. So
I was going to say it's sort of the same thing we're seeing here in Phoenix in some cases. Banner Health just gave us an update a couple of hours ago. If you want to watch the full briefing that they had for ABC 15, you can watch that on our website or on our Facebook page right now. But basically, Banner Health was saying that they're expecting to reach 125% care capacity in the coming weeks as these cases continue to rise. So that virtual update that came this morning says that she told us there are going to be about 1,000 healthcare workers that were actually coming from out of state to help winter coronavirus and care surge. So they still were pulling additional staff in to try to keep it covered. But I feel, Garrett, like I'm back to that point, sadly, that I was in June and July where I'm yelling at the kids if they go to the trampoline, be careful out there, be careful outside playing, don't ride your bike so fast, things like that, where other levels of care might be compromised or diminished because they're just so busy, they're so overworked, their beds are full, situations like that that make a mom worrisome in all of this.
I mean, I have just to, to put on an anecdotal observation. I talk to a lot of people on social media, especially healthcare professionals, medical doctors, and whatnot, because I do a lot of this COVID reporting. They come to me and they do messaging, and what I will say is of the ones that I interact with a lot, there are some that during the first surge, they were cautious, but they weren't panicked. And I can tell you that many of them right now are feeling more stressed about where we are right now, even though the numbers look a little better than the summer, because of what this hospitalization head count looks like and where they think it's going to go. There's a lot more of them that I talk to that are more nervous now than they were even in the peak of the summertime. So I think, and that's just, I said, that's my in-ground observation with only a few that I talk to about what's going on out there. And it just seems that there's a little bit, there's more concern from the healthcare professionals, even from what it was like back in July.
Yeah, I mean, if you're not wearing a mask for yourself, at least do it for the healthcare workers who are working incredibly long hours to try to keep us all safe. So as far as how numbers are today, obviously we focus a lot on Arizona here, and that's our main focus to keep you updated on those numbers. Across the U.S., 169,000 new cases reported in today and 889 deaths reported in. The states that are most concerning, there is a new state added today, and we're talking just pure case count at this point. California, that has been on the list. Michigan, Ohio, Illinois, and now Kansas. Kansas added to that list of a huge increase in cases that they're seeing overnight. So we just always want to keep you updated on that. That brings us, Garrett, if you will, to our RT Live site, or R Not number. Helps us better understand the spread in the community. I know Arizona is at 1.11 at this point today. We're seeing a lot more states in the green as they try to work to get these numbers under control, but still a whole lot of states in the red.
Yeah, and again, we've been at this 1.1. We talked about this yesterday. Mm-hmm. Arizona's been sort of hovering in this 1.1 to 1.15 range for several weeks, for probably 6 to 7 weeks now. And that's why we're growing at the rate that we are. This number, just so everyone understands, we'll say it again. This is 100 people. What 1.11 means is if 100 people had COVID-19, they can spread it to 111 people. So as you can imagine, as the time goes on, that is a certain rate of growth, and it can reflect an exponential rate of growth over a certain time period. So and we obviously want to be in a situation where we don't have any growth. And one of the reasons why it has remained consistent is because our growth has been consistent.
I want to get to some of the questions. You guys are coming up with some really good questions. Post them in the comments and we'll try to get those answered for you. One of the first questions I saw was from Brad on testing. He was curious how much testing is actually happening in our community right now. Let me see, Brad, if I can get back to your question. I don't know if I can find it. Basically, he was wondering if more testing is meaning more positive results. Obviously, more cases come out of those numbers, but the percent positivity helps us better understand if we're in a better situation or a more dangerous situation when we compare those. So is there data, there's his specific question, is there data on the estimated cases out of our 306,000 positives? Oh, I don't know if that was his question. but we can try to answer this one too. He was asking about the false negatives. Here it is. Thank you, producer Carrie, by the way. Does this graph reflect the amount of testing being done, which is likely far higher than what was happening earlier this year? So it is true. We have the capability to do more testing, to process more testing specifically, but that would indicate, Brad, that we should look at the percent positivity to better understand.
Yeah, so let's go through both of them so that we understand. So this is the testing graph for the diagnostic tests in Arizona. As Brad said, yes, there is more testing being done. We just recently surpassed, about a week or two ago, we surpassed the number of tests from the peak, and you can see now we're well above our peak, processing even in the last couple days upwards to almost 30,000 tests in one day. So we are very much going at a faster rate. But this is the other thing. While that number means something, obviously our percent positivity rate is also increasing. Our most recent number is about 12%. While this one's at 16%, we have to wait until there's only 1,000 tests. We have to wait for this one to have more tests to actually reflect this number. So we're going to stick with the 12% right now. And you can see this has been a pretty consistent growth, 11%, 9%. We at our lowest, we were at around 4 to 5%. And then, at our highest in the last time, we were about 21%. So we are testing more, but we're also getting a higher positivity rate. So let me show you what it is today. I'll just go through. This is if anyone follows me on Twitter, this is one of those things that I put on Twitter every day. This is our percent positivity rates by each county for today. You can see we're still in significant double digits in some of these counties. Cochise County, 27% positivity rate. Greenlee, 14%. We did have some small ones today. Tequila at 2.5%. Graham County, 26%. Yuma, 23%. So we still have several counties that are posting not just double digits, but very high double digits. And then Maricopa, which is obviously the best indicator of community testing, because a lot of the testing that's done in some of these rural counties is targeted testing. That's because it's easier to contact trace in Santa Cruz than it is in Maricopa County. So it's just one of those things. The Maricopa County number and the Pima counties, you can see 12 to 13%, and that's why our actual percent positive is closer to that 12% rather than this 23, 24%, because you get that community testing in those two cities. Sorry.
Yeah. That's okay.
Okay.
That's okay. That helps us, understand. And those are updated every single day on your Twitter page, so people can see the percents in the 15 counties that we have here.
So just what that is I basically take today's actual dates and yesterday's actual date numbers, and then I take 7 days back and cut it off. So I'm only looking at the most recent 7 days, and that's what I use to do the positives against the number of tests. That just gives us a better reflection of what's going on. Like, for example, today's John Hopkins number, the way that the data came in, is 30%.
Wow.
And if someone saw 30%, they'd be like, oh my gosh, Arizona has a 30% positivity rate. That's completely insane. We do not have a 30% positivity rate. We have nowhere near a 30% positivity rate. But because it's a reported number, sometimes if tests are taken back a certain amount, it just could change it up and make it look like it's much higher than it is, and it's often higher than what it actually is. That's why I present that 12%. And that calculation, because it helps to give a good idea of what daily is happening out there. But realistically, if you really want to know what the percent positivity rate is at any time and you want the most accurate information, you go to that AZDHF website and look at the weekly positivity rate for any given county. That is the best indicator of what's going on out there.
Can we show everybody exactly where to find that? I know for these next couple of days, we're not going to be with everybody every single day. So I want to teach all of you on here who are watching how to find that when we're not here with you, to show you where that is. So he's going to the Department of Health Services site for Arizona. And for those of you watching from other states, hopefully you can find this info as well, because your state hopefully is releasing this data, and you can find the numbers for yourself based on that. In your particular area. But for us here in Arizona, you're going to that AZDHS site.
Yes, I'm going to start here just because this is the very big first entry point. And then you go to this button right here for data dashboard. This will bring you to these dashboards. This is what we look at every single day. If you want to look at the laboratory testing, or the summary page is always there, so this is the thing we always start at. But if you want to look at the laboratory testing, it's right here. And then make sure that you go to diagnostic. And then it'll give you an idea of what's happening in all the counties. But this is what I'm talking about right here, is this number right here. So if I really wanted to see what was going on in, say,
let's do Yavapai County, because I don't know if Brant's on here, but he asks for that quite often.
Yeah.
Which number would you have him
this
look at?
This is Yavapai County's weekly positivity rates, and you can see they've had a tremendous amount of testing done. Their weekly positivity rate right now is about 16%. So that's a better reflection of what's going on in Yavapai County than even those daily numbers that I put out. Really, it's the weekly number is the best. So 16% in Yavapai County. In Maricopa County, for example, it's 12%. If you look at like Mojave County, we're looking at 10%. When you look at a county like Yuma, who's going through another sort of, this is 24%. So
wow.
Yuma is back in the really high numbers right now. That's you know, and Yuma was at one point one of the hardest hit areas in Arizona, and it looks like they're going back to it. Here again, 22% in Santa Cruz. So we look like we're sort of going back to, you know, some of the southern border counties getting hit harder than some of the other areas of Arizona. But really, what's unique about this one is that in the first surge, it really was the southern border counties were tremendously hit harder than the other areas, and now it's only a little bit more harder than the other areas.
Okay.
Sort of the community spread is really everywhere, unlike what we were at last time, where, you know, there was only certain pockets that were really growing and everywhere else was very moderate.
So you're asking everybody, if you're looking at this chart, just to refresh for people who are not on here every day, go one red dot in, because that red dot is giving us a more complete week. And Ellie's asking us if we could pull this for Coconino County for her, and we can, Ellie, while we're pulling this up. And Brant's on here, so he says thank you. So we're glad you're here with us, Brant. Got Yavapai County in for you. That's where you should check when we're not with you. So you can see the most solid number that's there without so many variables in it. What can you tell Ellie about this situation?
Oh, Coconino County's at 8%. That's actually a decrease from week to week. They were at 10% on November 8th to the 14th, and this week they're at 8%. So that's actually pretty good news for Flagstaff and Coconino County. They seem to be on a down slope right now. They're at 11%, 10%, 8%. They're at 9% right now, but again, that's only with one test, so or 11 tests.
Right.
So that doesn't mean anything. So as the data gets filled in, that might that'll sort of get closer to what the actual number is, and that's why we always go 1 point in, because now you've got, you know, 4,000 tests you're looking at rather than 11.
Yeah, 11's not going to give you such a great idea. Kind of like the reviews on a product you're buying. Let's look at the other one that gives you a little more information. So
Debbie is asking about Imperial County positives getting counting in Yuma, and the answer is no, they do not. They will be if in a situation they could be hospitalized at Yuma Regional, but I've called over there several times, and they insist that the numbers themselves are transferred to whatever jurisdiction owns the record. So if the person's a resident of Yuma County, then it stays in Yuma. Imperial County goes to Imperial County. Even if it's, I think, even if it goes across the border into Mexico, because obviously if you know that area, there's a lot of people that do the work visa crossings right there in Yuma County, and that record should go back to Mexico at some point too, if it is a resident of Mexico.
Yeah. Okay, so some good information. These are really good questions, you guys. Jenny is asking a question about the age group of the counts. So we luckily have that information for sure for Maricopa County. For AZDHS, yeah, it's on their site too, the demographics and how things break down. Jenny with an I for producer Carrie. Jenny writes, oh, I don't have her whole question there. Oh, there it is. What is the age range of the counts? So good. Thank you, producer Carrie, for getting her question in for us right there. What is
so here's the age ranges. We're at 15% for less than 20 now. It was at 14%, so it's gone up. 20 to 44 is at 47%, 150,000 of the cases, and this is cumulative. And then 40 to 54 is 45,000 at 15%. 55 to 64 is 35,000, 11%, and then 65 and older is 35,000 at 12%. So those are your counts for the age groups.
And those are not per capita. That's just raw numbers.
No, this is the actual numbers. I do have per capita. I was trying to pull it up quickly while you were talking, but I have to find it in my data, and as much as my data can be a bit of a mess sometimes, so that's why I do a lot of prep beforehand, so I know what I'm pulling up. So I'll find it, and as soon as I find it, I'll let you know.
Okay. Katya is asking about the IHME site and the current projections and some of the mandates that are on there that they've plugged into that. I'm going to caution that this hasn't been updated, I believe, since the 19th. I checked earlier today on IMHE's site, and I don't think that they've done an update since November 19th. So our data, our numbers, obviously we're looking at projections, but we don't have the last few days plugged into that. Are you able to pull up that site, Garrett?
Yes, I'm pulling it up right now.
We'll take a peek at how things look. So because they haven't updated it since the 19th, I would expect an update coming in the next few days, maybe the holidays playing into this a little bit. But so look at this with caution, but they are suggesting 14,000 deaths in Arizona by March 1st.
Correct. So that's, and of course, as we all know, because if you've been watching us a long time, you know that there's obviously an error bar to this. The farther you go out, the more uncertain these numbers get. So like, for example, if we go to December 14th, or if we go to only like a week, in, the error is only less than 1,000. It's say on December 8th, they assume 7,045 are dead with an error of 67 to 77. But when you go all the way out to March, they think they project 14,000, but the error bar is 11,000 to almost 19,000. So it just gets as time goes on, the projection gets a little more. Well, we don't really know. So
it's just like a weather forecast. There would be a greater variable the farther out you go in those projections, which is why most people stick to a 7-day, but you can online find 2-week forecasts for the weather. So similar thing here when you're looking at going all the way out to March 1st, and hopefully we'll have more vaccines on the ground by that point.
So I'm taking out these variables because we're just going to stay with the standard projection. This one thinks that we're going to continue increasing in our daily deaths until we get to about January 13th, and that's where we're going to peak and then continue downward. This is interesting. I believe we looked at this a couple days ago or like last week, and it had bent. It thought we were a little farther along, so that's interesting. It's pushing us down a little bit more, and we'll see what happens there. Daily infections, taking these out again, just to look at the projection. It says it thinks that we're about halfway to the climb, to the peak. It thinks we're going to peak just at the end of the year, and then it will start going down again. And just so, someone asked a great question yesterday that I didn't get to. It was about, does vaccines play into these models? The answer is no. And obviously, mass distribution of vaccines is going to drastically change these numbers, but they don't play into these numbers right now. So just to understand, this is just basically as things are right now, with no intervention in the vaccine.
And to update everybody, December 12th is the date that we're focusing on, when hopefully there will be some approval to these vaccines, and literally the next day is when they can start giving these out. So it's going to move very quickly once things get close to that, but everything's in production right now.
And what's interesting, of course, with that is, we go to December 12th, that if this projection is at all correct, what it's thinking is that we're going to hit our peak only about 2 weeks after that point anyway, and then we're going to start continuing down the slope. So that's just something to consider, that it's saying, well, we're going to be peaking out around that time anyway, which is interesting.
Yeah. And I think we answered, Richard, I hope we answered your question on there too, just now through that. Richard writes, how long do you expect this surge to last given the upcoming holiday celebrations this weekend and then in another month through the end of the year? So Richard, hopefully we got your question answered on there. But again, watch that variable of vaccines. Obviously on the 12th, it's not just going to be available to everyone, but they're working to get closer to that. And it matters which vaccine shows up for you, because transporting them, keeping them frozen, all the logistics of making sure the vaccines are on the ground is part of this puzzle too, to make sure everybody gets safe. We're tracking Pfizer's, Moderna's, AstraZeneca, Oxford, really all of them coming in the 90% effective range, as 90% up to 95%. So, all right. And then on this page, Garrett.
This is the ICU and the all beds. As you can see with the all beds, it does believe that there is a chance in January that we will exceed our total licensed bed availability. And we talked about that today, how Banner, you said that Banner, I believe it was, is expecting 125% surge. And this is probably why they have modeling that looks similar to this, that would show that there's a good chance that they may need that surge. And then the ICU beds, it right now believes that we're going to far exceed our licensing capacity, which is about 508, and it thinks we're going to be at 16. So and we'll see what happens there.
We talked about the Banner getting 1,000 healthcare workers coming from out of state to try to help with all of this. They say they still need 900 more who are needed to meet those staffing requirements for care for all these people. So just something to keep in mind as we're tracking this.
Correct.
All right. Okay. Anything else you want to highlight on that page, Garrett, or we can move on to active cases. I want to update everybody on that too.
We can move on from that. Let me go through active cases.
So I'll just preface this with everybody. To call someone recovered is a tough situation because everybody's definition of recovery is different, and there's not a universal definition for that. Some people say recovery would be a negative test. Some people say I'm tested negative, but I still don't feel like I did before I got this thing. So it's different for everybody. We've got 306,000, almost 307,000 cases here in Arizona since the pandemic began. As I always mention, you subtract out, sadly, those we have lost to this. And then you look at the collection date of this, this sample, if you will, where they got a positive test. And that's how you figure these numbers. We have watched this number climb dramatically. I want to say it was only like 6 weeks ago, we saw about 20,000 active cases here in Arizona. Where do things look today?
Yeah, it's much different now. Oh, I pulled the wrong one.
Disappeared.
Sorry. I was like, where is it? Yeah, I pulled an old one. Let me see if I can. It's re-rendering. You spoke so beautifully there, and I had it perfectly done, and then I was like ready to go, and now I have to re-render.
Well, thanks, friend. It's okay. I know that that this is a range that you sort of set this up with. So there's no exact number out there. You're saying here's the bottom range that we believe we have of active cases, and here's the top range of this thing. Obviously, there are outliers, people that are sick for a very long time who are fighting this. We're hearing of those more and more, and that's obviously a concern. One more thing as you're bringing this up, the conversation has started, and this was really breaking news just this afternoon, that how long does someone need to quarantine once they're concerned about this, and people are saying between 7 and 10 days now. So they're looking at shortening that quarantine window. We had watched it for about 14 days. So let's say you've been exposed to someone, you're notified, they say go home, stay home for 14 days, please go get a test, make sure you're negative. Now they're saying that quarantine period can be shortened if the person who was exposed also has a negative test. So you need two things. You need to stay healthy, to have that negative test and be able to pull that number down to 7 to 10 days instead of keeping it as high as 14 days that we've seen, and more recently 10 days. So even less than that, even fewer days than 10.
Yeah, and you can think of this as a standard bell curve in many ways. When you look at a standard bell curve, it's like a confidence of like 95, 98% or whatever, that things are going to occur within a certain range of that bell curve. And what they're saying is that, look, with almost all of these, if the certainty of your exposure is a little less, but you may still have been exposed, then realistically, if you're going to show symptoms, there's like a 95% chance it's going to come within day 3 to day 8 or something like that.
I have that for you. Within 4 to 6 days, 90% of people will then test positive and start to have symptoms. So you're talking exposure date to symptom date between 4 to 6 days, 90%. Now, as we always talk about the outliers in this, of course, there are people outside of that 90% who can test positive 14 days later or even longer. And
I mean, there are situations where maybe you were just exposed to such a very low viral load that it just and for some reason maybe your immune system is not where it should be, and it doesn't fight off the virus at that low of a viral load, and it just builds and builds and builds, and it takes 14 days, and then it hits. That can happen. But like, say if you get sneezed on by someone who has COVID, I know that that's a horrible thing to think of, but like, say if that happens, the viral load you just took is so massive that your system already goes into production, and that's why you get that's why you're basically showing symptoms within 4 to 6 days. Because your body's already reacting to it. So it really depends on how your exposure is. But like you said, 90% of these symptoms are going to onset within like 3 to 6 days.
Yeah, so they're considering lowering those dates, getting people back out there, getting them back to work or back to school, wherever they are needing to quarantine from. All right, so how do things look for those active numbers here in Arizona?
Said, I will not change my estimate. 14 days is still going to be my low estimate, and 27 days is still going to be my high estimate because as you said, these we do not have official numbers from health departments. This is an estimated range. There is no reason for me to be entirely 100% precise here. It's better for everyone to see this as a more conservative number rather than something that's precision in this case. So cases under 14 days in Arizona, there's 42,000 confirmed cases that are aged under 14 days in the state. There are almost 70,000, 69,400 cases that are aged under 27. So what does that mean? 42,000 people out there. Very likely that a good portion of those are infectious. And then of that 70,000, really probably the only infectious of those are likely that 40,000. But just in case, there could be as high as 70,000 people walking around infectious. But really, it's really that 42,000.
So, and those are, Garrett, just to be clear, those are confirmed cases. That the number could be much higher for people who are maybe asymptomatic and have not been tested, didn't know that they actually were carrying the virus.
I think I read somewhere that they're up to thinking, it used to be 10 times higher, but I think they're at like 3.5 or 4 times higher. So we'd be in the realm of 200 to 300,000 people walking around Arizona with maybe some sort of infection.
So one of the concerns that we heard about from Dr. Birx earlier this week in the COVID task force. Oh, by the way, Nicole's asking, where are these new guidelines coming from? It was from the COVID task force. They just had a briefing not too long ago, and I think 3 hours ago or so that information came out. So that's just the recommendation. So it's starting to be reviewed right now. Where was I? I forgot what I was talking about. That's a first. You can tell it's been a long year. These active cases out there, obviously the number could be so much higher. And Dr. Birx was saying that the age group that is so concerning about that number being higher and not knowing is the under 35 category. So those are people who might not have as severe symptoms. So they think, oh, it's just allergies, it's just this. They're writing it off to something else, and they're able to recover faster or not exhibiting as many symptoms. So she's saying it's crucial if you're under 35, please go get tested, especially. Go ahead.
Please. No, you
especially if you were going to see a family member or anything like that. Obviously, you can't test your way out of this. You can't test your way into safety because there's always a risk that you could expose someone. But really, that under 35 age group is the concerning one.
I mean, I'm not under 35. I'm a little.
Me neither. It's okay. It's all right.
But anyway, when I went to go get my test, that it was
right.
Work asked me to do it because I was in the newsroom for all of the election season. So I went and got my test, and when you do your rundown afterwards, it's they just say, oh well, if you start having symptoms, just take some Claritin or something like that. You know what I mean? Like it's
wow.
Yeah. I mean, what they tell you to do, at least initially, is very benign. And then call us, but basically just take some very simple over-the-counter medication. So that's to your point, where these 35-year-olds and younger especially, they may get the sniffles and they have COVID and they had no idea.
Yeah, so that can be the concerning group that's spreading. So you're lucky you even got that kind of advice. I just go for the saliva test, as I've told everybody on here for so long. And when you just go for the saliva test, they're like, next. Although I appreciate the efficiency and the response time is still quite low, even though it's increasing a bit. I've heard from folks who are trying to get in to get a test right now. Places are pretty busy, so just keep that in mind if you were planning things a ways out to go check to make sure you can actually get in somewhere to get a test. That could be the pre-holiday.
I think the airport is open now, right?
Yes, Terminal 4. So that's the other thing. Terminal 4, I believe it's on the 3rd floor. They have testing there, so you can get that done right there at the airport. They also said the city of Phoenix is covering it for costs for those who don't have insurance for the rest of this year. So about 5 more weeks, it is for sure a free test, even if you don't have insurance. So, all right. Okay. Brant is asking, what is the outbreak at nursing homes? So I believe the best place to send him for that, for Arizona's numbers, is to go just to Maricopa County. Wouldn't you think, Garrett, on that page that has schools and long-term care facilities?
I'm assuming he's looking at congregate settings, and we don't have
a chart like that.
I have, so I never use this chart. I'm just going to be completely honest, but I'm going to show it to you just in case that's what Brent's talking about. This is the congregate setting type at the azdhs. You can see it, assisted living and long-term care facilities, which these are the two big sort of assisted living homes, if you will. That's what 670 or 80, 680 that are right there. So that's what our outbreak looks like in sort of those sort of facilities in Arizona. So
you're looking at the Arizona page. They can also look at Maricopa County, where it's just got the 2 bars and shows schools
that shows, let me go to that too.
And LTC on the same one.
Yeah, I'll go to that really quick.
We also have updated reporting, I want to let you all know, on abc15.com. Our abc15.com/coronavirus has updated reporting on a long-term care facility as well that we have tracked out of Globe, and just a lot of cases out of there. We're finally getting more information on that, and our reporting came out at 10 o'clock last night. So if you're interested in a little bit more, you can find that on our website right now at abc15.com/coronavirus. But here you can see, just within Maricopa County, obviously most populous county, 528 long-term care facilities have had at least one case.
Yes. So no, this is 4,000. Yeah, 528 long-term care facilities have had one case. The number of cases they've had in Maricopa County, 4,781 among the residents. 1,305 of those have resulted in death. And then 2,995 have gone in staff, and only 11 have died in that category. But that is the congregate care setting in Arizona, what things look like. In the schools, these we can see what the school closures look like. 65 of all the 86 outbreaks in schools, 65 are open and 21 are closed. And then of the 426 COVID cases, 76% of them, 324, are from students, and 24%, 102 people, their staff. That's what the COVID situation looks like in all of Maricopa County's school systems.
All right. Tiffany's asking, are the tests at the airport mandatory? Tiffany, they are not. It's just an added service. There's also some signage out there letting folks know who are coming from other states that our situation here in Arizona. Okay, and Brant's asking about the R not number. We already went over it, so just roll back on this once it's posted, and you'll be able to.
Brant wants his Iowa number though, so
you'll be able to catch that info. You pull it up on there, Garrett. I want to remind folks a couple of scheduling changes, if we can, over the next few days. We want to remind you that the numbers for the school dashboard that typically come out on Thursday are going to come out tomorrow. So if you're interested to see, I know many school districts have already shut down, but there are a few in the East Valley that are still open, few sprinkled across Arizona. So if you want to see the school's dashboard number, it's going to be out early, happening tomorrow. I believe tomorrow evening, though, Garrett. We're not going to get it. 5 p.m.
5 p.m.
Okay, so we will not be here with you until Monday. Actually, I won't even be here Monday. I'll be back in a week on Tuesday with you. So we will, again, keep all of you updated on all this. Garrett, you'll still be here on Monday, but tomorrow's numbers, the school dashboard page, I want to remind people where to find it. It's on Maricopa County's website. So we're lucky enough to get this info from Maricopa County. And if you're looking for a zip code outside of that, it's not going to come up. But it's the school's dashboard site on Maricopa County's webpage.
Yeah, this is what it looks like: gis.maricopa.gov/COVID/schools. It's very easy to use. You just use this little drop down right here. You can go to the unified school districts. You can go to the high school districts, and you can go to the elementary school districts, as well as the city and zip codes, and see what things are like. As you can see, when we went over this last Thursday, obviously things are trending to the red in almost all situations. When you look at the numbers, it's more likely that the school districts are going to start looking more like the high school districts than the other way around. You know,
Yeah.
we're in a situation where some of these more rural, like Natiburg, and some of these are going to flip to red here soon. And the same thing with elementary school districts. Already, pretty much almost all of the these are all very rural districts that are in moderate. Everywhere else in the elementary schools have already flipped to red. So,
Yeah, that's
and some,
in the red. Okay, so I see we added the address right there. It's on the bottom of your screen. Be sure if you're interested in that to check that after 5 tomorrow night. My friend Gretchen on here, I see a familiar name, is asking that they've had a test pending since Friday. Are you seeing tests taking longer and longer to get results? Gretchen, yes, we are. We're definitely seeing that. So, you know, a lot of times with the saliva tests, we are seeing them later that day. We're seeing them a couple days out now, a couple more than what we've traditionally seen.
I would say 6 days is sort of the if you haven't heard from the provider within 6 days, then something could be wrong with the test, because really tests are being processed within 6 days. Right?
Okay. Yeah. So a little longer than normal, but yeah, be sure to get that information. Wanted to add that question in. We are out of time. We're going to be back here with you next Tuesday, and Garrett will be back here with you next Monday. Right, Garrett?
Yep.
I don't want to speak for you if that's not the case. Okay, so he's here Monday. I'll be back here with you on Tuesday. There will be a lot to talk about, so we'll get through it all. We'll walk through it very carefully together and keep you guys updated on this situation. Please have a safe and happy Thanksgiving. You as well, Garrett. Thank you. Be safe out there, everybody. Our very latest reporting can be found on our Twitter pages and Facebook pages too. Garrett's at Garrett, Twitter at Garrett_Archer. Mine is at Katie Rammel. You can also find me on Facebook at News from Katie, all those places. Thanks for all the happy Thanksgiving comments as well. We appreciate it with you. I cannot believe we are still here talking about this at Thanksgiving when we started this so early in the summer, but here we are, and we hope that the information is helping you to make the best decisions for you and your family so that they can stay safe and have a very happy Thanksgiving.